Do you need a probiotic? Do you need a prebiotic? What's the difference? I'm going to answer the first question first. I believe most everybody needs to take a probiotic. These are the bacteria in our GI tract that support what's called our microbiome. It is the relationship of our good bacteria to our bad bacteria. We're really good at destroying the good bacteria. Preservatives in our foods, antibiotic use, stress. It's amazing how hard stress is on our good microbiome, our good bacteria. So to answer that first question, and for the last 25 years, have taken a probiotic. I believe most everybody needs to take a probiotic. These good bacteria don't live very long, and unless we're feeding them with good foods like fermented foods, kimchis, those things that really feed the bacteria, they're dying off pretty quickly. So we really need to take a probiotic. We also need to be diverse. I really believe that we should switch our probiotic formula every 3 to 4 months as well. We need a diverse population. We need to use different cell forming units, different bacteria formulations, so that the microbiome is a diverse population. There's a blog on our website that I encourage you to go to, and part of that blog explains from a really highly respected gastroenterologist who he equated the probiotics with the potato famine. They planted a single species of potatoes, the famine came along, and all their crop died off. If you have an episode that affects your gut microbiome, and then you don't have a diverse population and you destroy all that, you lose your natural immunity for a long period of time. If you're very diverse, you may lose some of that population, but you're much, much better protected. So reach back in there, read that blog, ask us questions about that. Prebiotics. Prebiotics are food for bacteria, but they can also feed some of the bad bacteria. So do we need a prebiotic? I would say it's important to add a prebiotic periodically to feed those bacteria. Natural food for probiotics are fermented foods, kimchis, the types of things we probably don't eat much of, raw foods. So a prebiotic can be helpful. If you've not done a probiotic for a long time or forever, I would do a straight probiotic for a period of time before you add a prebiotic. And then sometimes you take one that has them both together, because you'll find products that have them both. You'll find probiotics specifically for women. You'll find them specifically for immune function. This is a spore biotic this includes a prebiotic. This is a high cell count probiotic. So there's options. Our staff is well schooled on probiotics. I talk about them all the time. This is an example of a poly prebiotic powder. It's food nutrients, things like pomegranate and cranberry. XOS is xylogosaccharide, so it's a xylitol-based saccharide. Your prebiotics tend to be vegetable sugars. That's a good way to think about them. So, do we need prebiotics? Yes, but they need to be timed right. You need to be taking a diverse population of probiotics, but I firmly believe that we need them both. So reach back to our staff, ask us questions, go to our website. There's some YouTube videos on pre and probiotics, but there's a blog that really explains it as well.